Thomas Jefferson founded UVA in the early 1800s. We have something called the lawn, which is where the students and the professors live together. The idea behind that is that education is a 24/7 process. It's not just in the classroom. I think to a large degree we embrace that. I think a lot of our faculty serve as mentors for residents and students in life in general. Today we have 17 faculty, every subspecialty covered with fellowship trained 2, 3, or 4 faculty in each division. We have a couple fellows, 15 residents. I think the camaraderie and the atmosphere here is really one of a big family.
The mission of our residency program is to train you to be excellent clinicians, both in the clinic and in the operating room. We'll give you extremely good depth and breadth of otolaryngology knowledge, experience, and surgical cases to make you an excellent clinician.
I think what sets this residency program apart is that it has all the complexity of cases and volume of surgeries that a resident could possibly want, and yet it's small enough where you can really focus on the individual residents and provide a personalized education.
During residency, you're in a very supported situation. You have attending coverage at all times. You have a constant source of learning, countless resources around, and that means really the possibilities are endless.
There is a lot of prestige here because of the faculty and the teaching that we receive. It starts with Dr. Park, who's our chairman and do hundreds of Mohs cases. Dr. De Niro is one of the best in the field. You feel like you get a little bit of a mini laryngology fellowship with him. Our peds department is growing too, and our head and neck is plenty of exposure in the operating room there. And Dr. Payne and Dr. Matos in rhinology, Dr. Kessler with his atresias, and Dr. Hashisaki is one of the wisest people I know.
An ideal resident is someone that comes in with enthusiasm for taking care of patients, and that enthusiasm becomes infectious. And the idea that as they progress through their residency, that infectiousness, that joy of caring for patients then translates to excellent patient outcomes, but also spreads to the junior residents and makes a great place to work.
The faculty at UVA will expect a resident to be hardworking, they'll expect them to care about their patients, they'll expect them to be inquisitive and want to learn. They definitely support us in the way that will make us successful as residents and then also as future independent physicians.
My advice to incoming residents is to think of it as a marathon, not a sprint, because there's so much to learn and you can't do it all at once. Set up some kind of rigorous, reading plan or study plan where you actually try to tackle a little bit each day, as opposed to cramming it all in on the weekends.
I think our attendings are great with giving us progressive autonomy. As you move forward, I think our attendings are great with trusting us more and recognizing that we can move a little more independently.
So intern year is, very steep learning curve, but we do hope that people learn from their mistakes and they're honest and that they are committed to getting better.
Residency is a big and important, kind of sometimes scary time in your life where you're taking on a whole bunch of new responsibilities and new challenges. And every resident has been extremely welcoming and extremely helpful.
So I think from a resident perspective, our team is really supportive and are pretty quick to reach out, and they're always happy to help.
I also wanted to go to a program where the residents were like family. On 6 West, which is our unit in the hospital, we are friends with our nurses and trust them, and vice versa, because when you spend 80 hours a week in the hospital, at the end of the day, you want to know that your residency team has your back.
I'm what's called the consult resident, so having the opportunity to be the consult resident as a first year I think is really phenomenal. It really lets me see ENT throughout the entire hospital. It shows me what role we play in patients' care, from really many different perspectives. And as the intern, I rely on the junior and the senior on call, along with the faculty on call, to really talk about these cases. And I've been so impressed at how available everyone has been.
The research is really kind of across the board, but you can pursue anything that you want, from benchtop research to clinical outcomes.
About half our residents go on to do fellowships. We have a terrific track record of placing our residents in absolute top-tier fellowships, and we're quite proud of that.
One of the things that attracted me to this area was just how much you can do outdoors. Living through the pandemic the last 2 years, it really makes you focus on what's important. The beauty of Charlottesville is that there's so much to do outside. In December, it was still 50 degrees and we were able to be outside, and I felt pretty safe doing that as well.
Charlottesville is a great community. I really enjoy this environment where basically nature is all around. You can go to a lot of breweries, you can go hiking, you can go mountain biking. There's a lot of beautiful golf courses here. You can walk outside the door and walk for 10 minutes and you'll find some place you've never been to.
I think the advice I'd give to anybody coming into this field is have an open mind. Residency is an adventure. You'll go through more growth during residency than you will really any other time in life. My advice would be to keep an open mind and take advantage of every opportunity that presents itself to you.
I feel that I could really decide on any specialty, whether it's becoming fellowship trained in head and neck oncology, facial plastics, laryngology, or deciding to go into private practice. And I feel like here they really just want you to figure out what it is that you want to do, and then they're going to help you get there.
It's an excellent program. It's very well-rounded. You get excellent training in all fellowship level divisions, and the residents have a lot of responsibility and a lot of autonomy in an appropriate setting. So I think it's an excellent training program in a wonderful location of Charlottesville.